Hello everyone, my name is Jessica Chaska and I'm a pelvic floor physical therapist at Ladybird Physical Therapy. Okay, so what I'm going to talk about today, it's called post-micturition dribble. What this means is this is leakage right after you've peed, usually within the next 5-ish, maybe 5 to 10 minutes, or it could happen like right after when you wash your hands. Now you might be thinking like, oh, that's really random, that's really niche, that doesn't happen to me, but I bring this up with my patients when they say, like, I don't know when I'm leaking. It's not when I'm coughing and sneezing, it's not on the way to the bathroom, it's not with jumping, all those things I'm good. They're like, I don't know when it happens. And then I ask them to pay attention to if it's right after like urinating or peeing, and then that's usually it. So why does this happen? I would say the most common reason, and this is really prevalent with my people that are newly postpartum, because it's being in a rush. When we're in a rush and like we're, you know, either in between meetings or our babies are crying for us or if we're just generally stressed, what happens is that the muscles are like, basically that sends a signal to your bladder that says like, hey, we're in fight or flight. It's not really the time to pee. Let's like wrap this up. And so the bladder doesn't do as good of a job emptying, and so urine will get stuck in the urethra, okay? Or the pelvic floor muscles are tensing and that's stopping the flow. Either way, what happens is that urine gets stuck in the urethra, okay? And so it's hanging out there, you stand up, your intra-abdominal pressure from standing and moving around push the urine out. So you get like a little squirt, just a little bit. It's not usually a big rush, like it's not a full bladder, it's usually just a little bit. So again, if this is like, if you're someone who's like, I leak but I don't know when, this is what I would try to do. So the first things, I call these bladder emptying techniques. So while you are peeing, okay, so stream's coming out, deep breathing, relaxing deep breathing, even if you are in a rush trying to get into that kind of zen moment, will help your pelvic floor muscles relax, and it will help your bladder contract better. Your bladder contracts the best when you are not stressed out. Okay, we're gonna think fight or flight versus rest and digest. When you're being chased by the tiger, your bladder doesn't want to be telling you that you need to pee. So deep breathing while you pee. The other things, these are probably more helpful when you're done peeing and you're just trying to get a little more urine out. So that's leaning forward, side to side. We're like literally trying to push urine out, okay? Other ones would be, if this is appropriate for you, you could do a few quick Kegels. So not while you're peeing, that's gonna stop the stream, but when you're done, that would pump the urine out, essentially, okay? The other one is called horse-lipped breathing, and I'm so glad I'm doing a video because then I can actually like show it to you. But horse-lipped breathing, when you're done, you're leaning forward, you're gonna go, okay, just like that. I would love to be in a public restroom and hear that. I'd be like, you go, girl. But anyway, so doing that, what that does is it allows you to push because you're exhaling, but it keeps your jaw relaxed. That keeps your pelvic floor relaxed, okay? So what I would do if you have leakage, you're not sure when it happens, try those things and see if that helps get rid of it. If it doesn't, this is where like a pelvic floor PT can really be helpful, because most likely what's happening is that there's something going on with the pelvic floor muscles or the abdominal muscles, and usually they're either too tense or too weak, and that's causing you to have this post-micturition dribble or leakage when you like don't really feel it. So if the pelvic floor muscles are too tense around the urethra, again, they're just like basically holding urine in, like they're not letting it get fully out. So the goal is more to relax the muscles so that you can fully empty every time, okay? And so sometimes just the deep breathing and things like that isn't enough. We actually have to work on that tension. Sometimes, and anecdotally, I'm gonna say for me as a clinician, this is less common, but not impossible, but it's that weakness of the pelvic floor muscles is creating a little kink in the urethra. And that essentially, like the urethra you think of it as more of like a slide, and if the muscles are supporting that slide. And then if they're not, then the urine gets stuck in these little like pockets, okay? And so then you stand up and then it falls out. So strengthening the support of the pelvic floor muscles can be helpful for that type of leakage if that's appropriate. The problem is if you don't like know which category you fall into, you don't know what to do about it. So that's where seeing a pelvic floor PT to figure out exactly what's going on with your body can help. So I hope that's helpful. I hope that if you have leakage and you just feel really stuck, you have a little bit more things to do about it. So thanks for listening.